Hi, Dr. Saxena here, Chief Medical Officer at Forum Health. Wanted to let you know if you're considering BrainRx, there's definitely some symptoms or conditions that were useful for helping. However, what I think is super important is that you know if you're a good candidate. So here goes a list to try to help you get a sense of if this program could be good for you. Suitable candidates for BrainRx with coaching support are people who have mild to moderate mental health or cognitive issues. So what does that mean? If you have difficulty falling asleep, but you don't need to take strong prescription medications. So if you have sleep issues, but you're not on strong medications. If you have depression, anxiety, but you're not having issues with suicidal thoughts or, plans, that you're on one or less antidepressants. And the major category we're talking about here are what we call SSRIs. And if you're on one of these medications, then we can use BrainRx. If you're on more psychiatric medications than one, we really would prefer that we involve a provider who knows how to work with your medications and adjust this plan. If you have memory issues, but not at the level of Alzheimer's or a dementia diagnosis, this program's for you. If you have cravings, and we'll call them kind of very bread and butter cravings that people have, whether it's for food, it's for activities that are not good for you. If you don't require therapy for them, that is significant. If you're not on any type of medications for those issues, or you don't have a diagnosed issue related to disordered eating, then this program can surely help. If you have issues with reduced focus, concentration, but you're not dealing with a dementia diagnosis, and if you have chronic pain, but you have no active addiction issues that are going on to pain medications, BrainRx is super useful for these types of patients. We take patients who are 15 and older. If you're in that 15 to 18 category, we really do require a parent or guardian be available and present, actively involved in the care alongside the coach and the child. It's also important that any child that's 15 or older has gone through puberty and is greater than 100 pounds for full safety. And then, of course, it's super useful to have a willing participant. So whether you're 15 or 45, it's super helpful that the patient is self-aware and is interested in learning the program to get better. So I'm hoping this helps you better understand if you're a suitable candidate for BrainRx. Obviously, you can always reach out if you have specific questions. I'll also make a video on the people who it would not be a great choice for, not because it wouldn't help, but because we'd want a provider involved. Thanks.